Hello again, my name is Janice Tania, and today I'll be describing the patient-provider relationship and how it has to be, and I'll be answering some of the questions that arises from a discussion I saw from a discussion given. So the first question was, how would you describe the communication that occurred between the provider and the patient? So in the book, it says the communication was overtly clinical, true, lacked emotional sensitivity. The provider focused on gathering medical facts rapidly, often interrupting the patient without establishing rapport or showing empathy. This created a sterile, hierarchical interaction that could make the patient feel rushed, dismissed, or unheard. I believe this is true because if you don't ask follow-up questions, try to make communication with the patient may feel bad and feel unheard, and the patient may feel that they did something wrong. So I think every provider needs to, first of all, create that patient bonding. Second is how did the provider interruptions of the patient communication contributes or detract from the provider's information gathering. The interruption hindered effective information gathering by cutting off the patient's narrative. According to Dupree concept of the video of livelihood of life world, patients share important health information in story form. Interrupting this narrative risk missing key symptoms or emotional context that could influence diagnosis and care, that could trigger or it might make you misdiagnose them, because they might tell you what had happened during this patient, Mrs. Jones. She was trying to tell the provider about what happened during the week. So, but the provider did not give any chance for her to explain it. So that will cause the provider not to provide enough information, that will cause the provider to get enough information from Miss Jones. Number two, so what did the student learn about communicating with the patient from this example? The students that were listening back, they said the student likely learned the consequences of poor patient-provider communication, diminished trust, incomplete information, and a weakened interpersonal relationship. They may have also observed how power dynamics and nonverbal cues can affect patients' comfort. That's it's true, because the provider was very it was very clinical terminology, described all terminology on point, and never tried to make fun, to communicate, to make way with the patient, or to try to make friendly moment bonding with the patient. So that did not work well. And next, describe how the provider nonverbal behavior communicated his or her status, role, and the role. What specific examples support your observation? Standing while the patient was sitting, and exposure in paper gowns suggested authority and lack of intimacy. Limited eye contact and a clinical tone further emphasizes a professional distance. This behavior reinforces a power balance imbalance and minimize patient comfort. The patient might feel uncomfortable because the provider is standing while the patient is sitting. So the provider and the patient need to be in eye contact to make sure the patient feels welcome. The patient says, okay, they're comfortable with this situation. All right, number 5 is say, what verbal communication from the patient could you likely to have expanded? The patient's something that I needed that could be expanded is the patient's comments. I was having kind of a rough week. As a provider, from that you will kind of have to ask open-ended questions, because that leaves an open-ended question for you for the provider to ask, okay, oh, what happened? Oh, Miss Jones, what happened? Oh, tell me all about it. So yeah, that affected it. Said, and deserves follow-up. It could provide insight in emotional stress, lifestyle factors affecting her symptoms. Important context often missed when focused solely on clinical data, which the provider focused on. What verbal communication from the provider would you likely change? Statements like, we call that loose stool, because when he was trying to explain to Miss Jones, saying that, oh, how was that did you have any bowel movement? And he says this says, oh, kind of. And he says oftentimes, and he says loose stool. So that right there, it kind of break the communication. So so the statement like, we call that loose stool or abrupt topic change should be reframed more empathetically, so like he would have been able be more empathetic to the patient by also, oh, I'm so sorry that this happened to you. Okay, how can I fix it? What are some of the symptoms you have? Or like try to act in different ways to make sure that the patient is more safe in that context. Instead, the provider could validate the patient's experience before explaining terminology, using open-end questions, reflective listening. Why more effective? True, like I explained before, that if the provider was more open to listen to the patient, he probably would have been able to know exactly what was wrong with Miss Jones, but he was not. He focused mainly, he wanted to get all the data on point. And second to the last question is, identify 3 or 4 behaviors, like verbal, non-verbal, that would help to enhance an interpersonal relationship between the provider and the patient. Why is an interpersonal relation important to provide patient interaction? So begin with a friendly greeting and use the patient's name. Yes, like I said, maintain appropriate eye contact and sit at the patient's level so the patients can be comfortable with you. Use open-end questions to let the patient share their story. Yes, so that once they say that, you tell them, oh, I'm so sorry this happened to you. Oh, so what did you do next? Did you try to take something? It was somebody at home that could help you? How did it happen? And all those open-end questions. Reflect back or summarize that the patient patient says to show understanding. A strong interpersonal relationship fosters trust, improve patient satisfaction, and increase the likelihood of treatment adherence and honest disclosure. And the last question is, why is an interpersonal relation important to providers patients interaction? An interpersonal relationship is important to provider-patient interaction because it builds trust, encourages open communication, and makes patients feel valued and heard. When patients feel respected and understood, they are more likely to share important health information, following medical advice, engaging in their own care, leading to better outcomes and higher satisfaction with their care experience. And that is what we all strive to do. We all strive to make sure that every patient have a better satisfaction of their care provider. So us as future care providers, we need to make sure that the patient is comfortable. We need to make sure that we understand the patient and ask open-end questions to make sure that we meet the patient in their level. And that, my friend, will better our answer choices to patients. Thank you.